Hello, I am Marwan Abourass. You do not have to use intracanal medication such as pharmacresol, CMCP, calcium hydroxide, antibiotic paste, corticosteroids if you have done the following 6 steps. Number 1, standard rubber dam isolation. Number 2, coronal cleanout, complete. Standard endodontic access, ideal one. Number 4, indicated occlusal reduction if needed. Number 5, complete removal of the pulp tissue remaining or the filling materials from a previous treatment. And number 6, and most important, that the canals have been chemically and mechanically prepared, enlarged, and ready to obturate. I would like to share with you the intracanal drainage chamber technique. I call it ICDC. It's specific for endodontic temporization. It's a best practice. It's a best practice that I developed when I was at USC during my teaching career, and we also used it abroad. The method is evidence-based. What I mean by that, every step in the procedure has been taken from a valid literature sources. It's made to prevent endodontic flare-up between visits, reduce the number of emergency visits, thus making endodontic efficient and patient satisfied and happy. It's based on 2 principles. The first principle is to maintain a good coronal restoration, temporization, by prevention microleakage. And the second is to provide a mechanism to accommodate the periapical exudation, the periapical tissue fluid resulted from the autoimmune inflammatory response which occurs after endodontic treatment initiation. You may ask how we do that. Well, this is how. When the root canal is cleaned, shaped, and enlarged, and left empty inside, and the apex, the apical foramen is patent, the pulp chamber is clean and has a dry gauze, no medicament whatsoever, then if you have exudation, increased periapical pressure, the foramen will act as a pathway for the tissue fluids to enter the root canal system, the different canals, and from there with capillary action, go to the chamber and be sponged, absorbed by the cotton pellet or the unwoven gauze which you place there. This is how we've done it. We've done it for 40 years and more. And we do not medicate. None of the essential oils or CMCP or calcium hydroxide, any material. We basically do a good job disinfecting, preparing the canals, and built-in system internally to do the drainage. Thank you for listening, and we will present this in a technical technique later on. Thank you.